So as our next presenter, I would like to welcome Dr. Bhaswati Bhattacharya with her presentation, Emergency Medicine in Ayurveda.
Slides.
Pardon?
Slides.
If you can please sit here and use the, you can do that from here. Point to the computer. Mm-hmm.
Okay, and you've got the clock on.
And the clock is on.
Good morning. Dobre dano. I am Dr. Bhaswati Bhattacharya, and in addition to having a modern medical degree in medicine, I have a modern pharmacology degree as well, and a public health training. I've traveled around the world and seen how medicine is actually practiced in different countries and in emergency situations when there are crises or trauma. In addition, I have a PhD in Ayurveda, and I know we're talking a lot about Ayurveda today here, so I will try to make it a little bit more integrative. But one of the reasons that I, as a medical doctor, studied Ayurveda is that instead of focusing on molecules, as the last two presenters did, and on the identification of pure, meaning something that is isolated, reductionistic, and is one molecule acting on one organ. When we have emergencies, it's the whole body. It's not just one organ. So I'd like to take you through some of the things that happen in Ayurveda, where people sometimes think that Ayurveda is just a preventive medicine, or they think yoga is just a preventive medicine, preventive system. It's actually more. So let's think about how something which is supposed to be just a health concern can actually address serious whole body medical emergencies. Where do medical emergencies occur? And this framework helps you to understand that Ayurveda is not just ancient, but it has so many remedies for so many levels of wellness as well as unwellness, which is illness. Where weapons occur, that is where you will see emergencies: battlefields, prisons, hunting, and in people's private homes. Where doctors exist, you will see emergencies: ICUs, cardiac care units, emergency rooms, operating rooms. There was actually one study in Canada, and it was replicated in a few places around the world, that showed that when you get rid of the doctors, in other words, they go on strike or they're not working, the medical emergencies actually go down. That doesn't mean that people are not treated and die. It means that people actually don't get so sick. And it's a very curious study that leaves us wondering, okay, why is that? So think about that when we think about usual emergency medicine care. Where people work is also where emergencies occur, in factories, kitchens, out in nature when they're hiking or being around the elements. And of course, in the modern day, the motor vehicle related. Most places will talk about lab tests as the symptoms or situations, but in addition to the numbers of cardiovascular arrests or sepsis, which is fever and whole body being either in a crisis situation or an inflammation situation, and accidents, which I mentioned, there are symptoms that happen to people. And those symptoms are the things that Ayurveda addresses rather than statistics or organs or molecules. So rather than saying you're having a serotonin emergency, looking at the whole body of what happens. Ayurveda has been looking at these things for over 5,000 years, and there are a lot of remedies, but they are not included in the medical system. So people say, well, there was no emergency medicine in Ayurveda in ancient times. And one of the reasons that I love talking about this is that the Ayurveda people today, most of them, are telling people that actually Ayurveda is just for prevention. In fact, people in the Ministry of Ayush tell people that it's just for prevention. And I want to tell you that most of us who have practiced Ayurveda in a real way use it because in ancient times there was emergency medicine. In the brown boxes are 3 names: Sushruta, Charaka, and Nagarjuna. These are famous Ayurvedic scientists and clinicians from older times. And they talked about surgical emergencies. They talked about wounds and burns and cancer and stroke and labor and delivery of babies. And, of course, sword injuries at the time of battle. They talk about more chronic diseases and the emergencies that come from those, such as strokes and neurologic emergencies, or emergency conditions where Vata, so you have to understand the language of Vata, Pitta, Kapha, and Vata means there's too much movement around the body and inside the body. And that means on a micro level, when there's too much movement in the cells in a wrong way or in an imbalanced way, it creates inflammation and imbalance. Nagarjuna was a specialist of poisons and severe medicines of herbal minerals and metals, and used them for many very difficult conditions. And I find this to be very interesting as a medical doctor, because I would like to find better, faster, cheaper cures for my patients who have emergencies. And so there are a huge number of modalities. I'm going to take you through a few of them in the next slide. First, in a couple of slides. First, I want to just mention that there is a big component of emergencies, which is pain. So if any of you think about your emergencies that have happened in your life, of family, friends, or yourself, you probably think of severe pain that you went through. And it's very curious that even the International Association for the Study of Pain has only recently come up with a real definition of pain, and they still continue to evolve it. And you know, it's not just a physical, chemical thing. It's also about a personal experience and about the emotions and some kind of conflict between the soul and the mind. And of course, that four-letter word soul is very controversial, right? We shouldn't talk about the soul. But in fact, it is something that happens when people have pain, and it is a very, very important component of what we must attend to as medical doctors. If we don't, we are ignoring a big part of what's going on with the patient. So pain is here, and actually one of the world's pain experts from Ayurveda is going to be giving a talk later today, Dr. Kuldeep Pandey, who is from one of the oldest cities in the world, Benares, where they know how to work with pain. So you'll hear from him. But if you look at this definition of pain, I invite you to think about it and where it affects you in your life, because all of you who are healers and most of you who are patients have experienced pain. And when that happens, you just want the pain to go away. You don't care if it's homeopathy, Ayurveda, herbal medicine, whatever you want to use, manual therapy, some adjustment of your spine, you don't care. You just want the pain to go away. So who is in pain? You should just know the statistic. There was actually not many studies, but there was one that showed that across 52 different countries, about 27% of people say that they are chronically in pain. And between these 52 countries, it ranged between almost 10% and over 50% of people. That's a lot of people living in chronic pain. And we as healers need to focus on this pain, because whether we're working on a chemical level or a psychic level, we must address it. And as mentioned, the Ayurvedic component of that will be discussed later in this conference. So this is a slide that's very busy. If you look on the left side of each square, these are different symptoms that were the same symptoms in those check marks in a few slides ago. And on the right side, for anyone who knows Ayurveda, actually I'm quite surprised that many of my Ayurveda students have never even seen these medicines, and they're all part of Ayurveda, which means that when they're learning Ayurveda, they are no longer learning about emergency medicine in Ayurveda. What they are learning is that it's a preventive. And when we do that, we are slowly, slowly making the science of Ayurveda disappear and making it more into a spa kind of a treatment. So for someone like me who does treat emergencies and has done international emergent relief operations, I love the fact that there are so many of these. So I'll just take you through a few of them. Someone once said to me, "Oh, but Ayurveda has nothing for the heart. I mean, you people just deal with, overall nutrition." There is a group of compounds which are plants that have been mixed with ores of metals. And I can talk to you for 4 hours about metallic medicines. The science is called Rasa Shastra, and one of my delights has been to come to Prague and learn about the alchemy, which many of you already know about. It's thought to be a fable or a myth, but in fact today, my mentor, is one of the world's authorities on how to take metals such as iron or copper, which are in your body, and get them into nanoparticles and microparticles so that they can come into your body, replenish those enzymes and cofactors that are part of your functioning molecular body, and make those work again in a normal way. And to see people have these changes, I would tell you stories from my own clinical practice, and you would say these are only anecdotes. So I just want to see, anecdotes are just one-by-one cases. You want to see something that's randomized, controlled trial in order to believe what I'm saying. But as a clinician, I know that when a surgeon does an operation, they don't do randomized clinical trials. They do surgeries for specific patients. So like that, when there are emergencies, and I can give certain of these bhasma, that's the metallic medicines, it's amazing how they work. So I'll just take a couple of examples from this, and if you have taken a picture of this slide and you would like to ask me about any of them later, I'm happy to tell you and teach you what the components are. And as I said, I could spend a lot of time on this slide and tell you what each one is made of, how it's made, and what the way is that it's acting according to Ayurveda. One is fever. So approximately 3 years ago, right now, we were going through a period of time around the world where a lot of people were having fever. They were going into respiratory distress, and then they were dying. And what we found in Ayurveda is that we had already compounds for fever, and we tried them. And 2 of them are listed here, Jayamangala Ras and Mrityunjaya Ras. And the doctors that used them found that they actually relieved the fever that was happening in these patients. The ones that had advanced to respiratory distress, there was one medicine that was very, very good, Trailokya Chintamani Ras, that's used for sudden respiratory complaints. And I find that asthmatics who use this, and people who have interstitial lung disease, people who have emphysema, which is incurable according to my medical books, they can take certain compounds and slowly rebuild that tissue, which is considered impossible in everything that I learned in pharmacology and in modern medicine. And when I see that something that I learned was impossible, and I go to a place where I can see this happening clinically in the hospitals there, it is shocking for me as a doctor. But I am one of the people that is creating that bridge because I was taught not to believe that things are not possible. And then I have to see it with my own eyes and realize this is possible. That person was paralyzed and had no hope of standing up, and now they're standing up. Or that person had so much respiratory distress, and now taking Mahalakshmi Vilas Ras, which was one of the compounds I recommended. Another is silver. All of you have heard of silver. Maybe you wear jewelry of silver. Silver is not just an antimicrobial. It's very good for the lungs. And I use it in my cancer patients, lung cancer patients. And I get incredible results. So I want to just expose you that these are possible, both in emergency situations and in very severe situations. And that is one of the reasons why I am so supportive of Ayurveda as a medical doctor. The last one, before I turn the slide, is renal stones. There is actually a plant that if you give it, it's called pashan, which means stone, bhed, which means to break. And you give the person this as a pill, 2 tablets 3 times a day, and their kidney stones go away. Imagine the pain of renal stones and it going away. And imagine being a medical doctor and never having heard that this is possible and seeing it actually happen. So I welcome you to come to India, as Thomas and many of you in the room have come to India, and to find a place where they're actually doing this authentically and come and see what's possible in modern medicine. I invite all of you also to create an emergency kit in your home. My mother had one of these kits, and she kept certain things there. Cumin is a very good digestive. It's very, very good for the gastric system. If any of you are experiencing bloating or difficulty, please go down to the kitchen, talk with Alice, and ask her for a little bit of ground cumin in some hot water, and you'll see that the bloating will subside. Menstrual cramps, take some of the cumin, put it in some oil. Usually we use sesame oil, or sometimes we use castor oil, and just rub it below your belly button, above your pubis, and just rub it in a clockwise direction and find that the menstrual cramps subside. So these are emergencies in a home level. Rose water, some of you are red. I saw your skin is red, and I asked, and they had just been to Portugal and sitting on the beach, and it's called sunburn in English. If you take rose petal water and just spray it on the skin without touching it, it will cool the skin and take away that emergency of sunburn and that heat that is very debilitating for people. Jattamamsi is a very good component for mental issues going on. There were a couple of talks yesterday about mental health and mental overwhelm. We call it anxiety. And Jattamamsi should be used in combination with a few other herbs to make that a well-being formula, but also an interventive formula for bad dreams. If any of you have had chronic bad dreams, Jattamamsi is a wonderful plant for that. I can go through each of these one by one. I've done a lot of work on cannabis, and the one thing I want to say about that is in some countries you can't grow it in your home. It's not legal yet. And in most countries they're using the extracts. But in India, where it grows like weed, we take it and we actually put it through a purification process. And that includes one of 5 or 6 different herbs that is mixed with. Unless you use cannabis that has gone through that process, it is poisonous. And in fact, most of the difficulties we are seeing with addiction and people who don't have mental acuity after using cannabis, it's because they don't know that they should be taking the leaves of the plant and mixing, or even the flower, but usually it's the leaves or the stem, and mixing it in a process called shodhana. Shodhana doesn't exactly mean purification, but it means processing so that it will be optimal for the human body. So anyone that's smoking or vaping or eating gummies, if you take cannabis that's not gone through shodhana, you're giving your body a risk. Whereas in India, they actually make a jelly, or a, you can say it's called a chutney, and they take the leaves, they do the shodhana, and they keep that chutney, and they use a teaspoon of it for sedation, or for if they're very tired and they can't sleep, they use it well. And this is an emergency kit for people who need to be sedated at home because they're in severe pain. Turmeric is another one I have to mention because it's one of the most famous compounds. It's not turmeric, it's turmeric. And its Indian name is haldi. And it is, or haridra is actually the Sanskrit name, and it is an anti-inflammatory, an antimicrobial, and also a hemostatic. So that means it kills germs as an antimicrobial, it lowers inflammation, and it's also very good for stopping bleeding. So if someone has a cut, mom will go to the kitchen, get some turmeric, and rub it on the child's cut, and it will instantly stop. Not instantly, but in 5 minutes, it will stop the bleeding, and it will be an anti-inflammatory. And if you mix it with slaked lime, which is, you know what lime is, it's a calcium carbonate, you mix it together and you put it on any fracture or any place that has swollen, it will reduce, because it's an astringent, it will reduce that inflammation, thereby preventing the breakage of capillaries in that area and reducing the overall damage in the area and thus the pain. So these are some of the remedies that I wanted to share with you, and I hope that this has been useful. I can't help but say gold because I love my gold. Gold is actually a wonderful immune enhancer. And if you can drink gold, there is drinkable gold in that speculum alchemy, which is here in Prague. But if you can get one pure piece of gold, which is 24 carats, put it into a jar that is glass, and pour hot water on it, it will leach 5 or 6 pieces of gold, and you can then take the water and drink it, and slowly it will build your immunity. Rheumatologic pharmaceutical drugs have found this, and they actually put gold in their rheumatology products that they give to patients. So modern medicine has kind of discovered this, but Ayurveda knows how to use this well. And we give this to young children at the first few months after they're born, and it helps them with their immunity so that sometimes they can withstand if they have to have vaccines, or sometimes they defer vaccines because it builds the immunity so well. So in India, the Ayurvedic pediatricians are specialists in gold, but I'm mentioning to you emergency situations. So people will say, well, why would we use emergency medicine, Ayurveda? Why don't we just use what we've got in modern medicine? It's great. Billions of people think that pharmaceutical medicines and surgery are the only treatment option. And those of us here in this room, we know that there are other options. We know that there's something other than surgery and opiates and sedatives, because those have lots of side effects. They have a certain amount of dysfunction of other parts of the body, and they can lead to addiction. And right now in the US, we are dealing with an opioid addiction crisis because people were over-prescribed opiates for any and all kinds of pain in the last decade. The consumers, though, are losing faith. And many will say, I've lost faith in the system. It costs too much. It forces me to do things I don't believe in. And I want alternatives where I can feel that I'm in control and where deeper healing happens on a whole person level and not just on a molecular level. And that is so important for people who want to keep their whole body intact and don't want to be treated like an amalgam of molecules. They want the whole body to be addressed. They want their mind, emotions, their psyche addressed. And they don't care if modern medicine doesn't believe in the soul, because the soul is what holds it together. And they want that addressed. So in America, we have a huge amount of money poured into this, and we have a terrible level of care. Yesterday, one of our fellow Presidium members mentioned that 1 in 3 patients, well, 1 in 3 patients uses some kind of alternative medicine, but it's a 3rd leading cause of death. Modern medicine is the 3rd leading cause of death in not just one study, in many studies. If you are an evidence-based medicine physician, you should pause thinking that what you are prescribing every day is leading to the 3rd leading cause of death. That is a very serious charge, that what I put on my prescription pad has a very high chance of not just injuring you or making you lose your hair, but of killing you. And in Ayurveda, that is not a definition of medicine, if you kill someone from the therapy that you give. This is my last main slide, and it says, if Ayurveda is so effective, why is there so little research to prove it? Someone yesterday said, well, there are very few studies that are high quality in alternative medicine. And I have to laugh, because first of all, there are a lot of studies, and some of them are high quality. But the reason that it's not in Ayurveda is something I wanted to explain, because I don't see this explained very often. Number one, modern research designs the evidence-based medicine paradigm of methodology based on what can be shown in pharmaceuticals. So you can do these randomized, double-blind, placebo-controlled trials with pharmaceuticals. In addition, if you show that any herb or any intervention is effective, you have to file a new drug application with the FDA in the US, and that application form, just to hand it to the authority, costs I think it's now $1.1 million. $1.1 million. That's a lot of slices of pizza. And it is huge to just put in an application fee for new drugs like that. In addition, you have to show that there are studies. So in Ayurveda, we don't randomize, because you need something, you need something else. If you both have the same disease, I can't give you each the same drug. So how can I randomize you? It's not possible. And any intelligent system that has a specific and individualized, personalized approach, just as healing is, just as biotronics healing can be for many people, but there's a specific application that Thomas uses for specific people. In the same way, Ayurveda uses specific medicines, so you can't randomize. You also don't want the patient to be blind. Do I want you to be ignorant to what you're getting, that you don't know what you're getting? No, I want you to know, and I want you to use that inner force within you to bring that into your body and evoke healing. And as the physician, I want to evoke that. So the idea of blindedness is nonsensical in Ayurveda. So now you can't do randomized, you can't do double blind. Now placebo-controlled, Ayurveda believes that the greatest placebo is the inner pharmacist in your body, which dispenses medicine. And I have 1 minute, yeah? And it dispenses the medicine that you need in the amount that you need, where you need. And if you have that inner pharmacist within you, then you should try to optimize your placebo effect, not to control for it and subtract it, but to optimize it. And therefore, Ayurveda doesn't really believe anything is placebo. So if you take away these components one by one of the way evidence is created, you'll realize that clinicians in Ayurveda ignore this nonsensical methodology. They just treat the patient. They don't bother setting up controls because they want to treat someone individually. They don't waste time and money on that. They just treat patients one after the other. They don't advertise what they do, and they oftentimes don't share their protocols because they're sick and tired of doctors coming to them and basically criticizing them and making them humiliating them. So they ignore them. And we lose because we don't have any way of knowing what they're doing. So in summary, Ayurveda is an ancient system of personalized medicine. It contains thousands of medicines that go well beyond wellness into emergency care. Thank you for listening to me. Namaste.
That was Dr. Bhattacharya and her emergency medicine in Ayurveda. Thank you so much for your contribution.